So the first comment I got, the very first one was a senior government official talking about joy and wisdom. That takes guts.
Yeah.
That was the first one I got. Okay. And it does take guts. You know, sort of like stress, which nobody wants to talk about. Okay. Joy seems to be the other elephant in the room that nobody wants to really talk about. And yet, what I'm hearing you say is, without joy, we're not going to get these behavior changes that we really need.
And we really need to find out what's important for us. It's customizing fitness, it's customizing health, it's customizing wellness. What's good for you is different from me. And what makes me happy and joyful may be different from what makes you or you. And so until we get to that personal point, I don't think it'll sustain. We can do a number of things. We need to do the other things we're doing as well, but put joy in it.
We had another audience member said, well, we're dealing with psychiatric services totally differently than we're dealing with physical services. You know, is it any surprise that we treat these sort of emotional disorders as if they were almost, you know, pariah special things? You've got to have a strong opinion about that.
Well, I'm a family doctor, so I think specialists are very important, but we also at some point have to bring it all together. And this, you know, we're experts in government of doing the silos, but it's time that we start working together. The same thing in wellness.
I had another question from the audience. Is there a role for government to make people accountable for unhealthy choices? You know, obviously, you know, many of the choices we make are not with total ignorance. Yeah. We've been told enough, from cigarette packages to obviously eating. You know, there's a frustration for people who look at people who seem to make unhealthy choices, and then obviously, where's the government's role in this process as you see it from your vantage point?
Well, there's obvious science will, I mean, the studies will show that there are things that some of these incentives will work. I have a personal opinion that we should stop being so negative and start doing the positive things, let people can take control. Government's role is to give them the tools to help them, give them the information that we just saw in the last speech. Giving them the information, people want to be healthy. You know, when you start to penalizing people, you don't know what their reasons are. They may not eat healthy foods because the foods might not be available. We don't know what they are, so we need to be positive and encouraging and getting them to want to be.
So it's a bit like it's easy to demonize what appear to be choices, but until you walk in somebody else's shoes, I wouldn't be so quick to judge.
Exactly.
Okay, I think I got that right. Okay. Last question here is, you know, you said something which is a bit of a heresy. The medical community is perhaps my biggest resistance. You gave him a little air cover on that firefighter metaphor, but, you know, physician heal thyself here. Are you telling me that the community we turn to has to be re-energized and retaught why prevention is so central? Well,
we're taught, and it's not a negative, we're just taught to keep you alive. I mean, if you're laying there bleeding, that's my job right now. Right. It's not my job to sit and figure out, you know, whether you have a smoke detector in your house at that moment in time. But at some point, we have to understand and take into consideration doctors are under a lot of pressures, nurses are under a lot of pressure, and we have to find a way to help them. Help them get prevention into every day.
Maybe a new kind of medical specialist, a prevention doctor.
Well, we do have a specialty in preventive medicine, so
maybe we just need a few more of those.
A few more of those. And Dr. Heal Thyself, make sure you take your flu shot.
Dr. Benjamin, it's a privilege. Thank you for the service to our country.
Thank you.